Hello, this is our last lecture for the circulatory system and heart disease, and we'll be focusing on section 5.7 that discusses cardiovascular disorders. I will start repeating some of what we ended with on lecture part 3 because technically it's in section 5.7. Um, okay, so as I've stated before, heart disease is the leading cause of death for men and women in the United States. I'm going to start with reiterating what is high blood pressure referred to and what is that an indicator of. So, high blood pressure is also referred to as hypertension, right? And so, when doctors measure that your blood pressure is elevated, then that is a sign that you can have heart disease. And the heart disease that can lead to high blood pressure is atherosclerosis, which is a buildup of plaque inside of the arteries, thereby reducing the diameter of the arteries that the blood can flow through. And so think of the hose. If you put your thumb over it, the water is under higher pressure because you're reducing the area. In arteries, if there's plaque, the blood is under higher pressure. And that's very dangerous. And the reason this is dangerous is because constant pressure on those arterial walls can lead them to rupture. And if the plaque deposition is very large or it moves to a very small artery, it can fully block the blood flow in the artery. And that can lead to many things that you know of, such as stroke, heart attacks, aneurysms. And so, just for definition's sake, all of these disorders, stroke, heart attack, aneurysm, are basically caused by high blood pressure or atherosclerosis. So, a stroke is when an arteriole, a small artery in the head, bursts or is blocked by plaque. Okay, so that basically what happens is that it blocks blood flow to a certain part of the brain. And if the neurons in that portion of the brain don't get blood, then they don't get oxygen, they don't get glucose, and they can die. And that's why often the result of a stroke can be death or paralysis on one side of the body, problem speaking, because you're actually damaging a portion of the brain. A heart attack or a myocardial infarction is when an artery that delivers blood to the heart, which is a big muscle, is blocked. There are very small arteries, the coronary artery, that gives blood to the heart, and so it's pretty easy for it to be blocked. Lastly, an aneurysm is when there's weakening or enlargement, or sometimes I refer to it as ballooning of an artery. And so here I have a little picture to help you visualize it. On the left, you see a normal artery, and on the right, you see an artery with an aneurysm. And so, why would this ballooning occur? And it's the result of continuous hypertension or high blood pressure. And that constant pressure against the arterial walls causes it to loosen. Think of it as like a rubber band that has been used too many times and now is expanded. And this is dangerous because often people don't know they have an aneurysm, but because it's so ballooned and weakened that it can rupture easily. Okay, so next I'm going to talk about some of the procedures that are done medically to deal with some of these problems. And so if if there is a heart attack or if there is blockage in some of the arteries that deliver blood to the heart, okay, blockage that can result in a heart attack. So a person may go in to the hospital with a heart attack and find that they had a heart attack because there was blockage in the arteries that feed the heart. And so in this picture, what I want to draw your attention to is where it says blocked vessels. So you see those little red bands. All right, so these are blocked arteries. So this is the coronary arteries that give blood to the heart. And so here the person has how many blockages? They have 1, 2, 3 blockages. So if someone has three blockages, what would often happen is that they would have a triple bypass surgery. So there, the doctors would get a blood vessel from a different portion in their body and they would bypass the blockage. So here you can see that these grafted vessels are from somewhere else in the person's body, often the leg, and then those vessels are sewn from the aorta and they go past the blockage to deliver blood to every tissue that is after the vessel that has been blocked. So sometimes people may have just a bypass surgery, which means they only had one blockage, or a double bypass, which means they had two, or a triple bypass. Now, these are fixes, but they don't really help the underlying issue, which is that the person probably had blockage because they had atherosclerosis. So this doesn't do anything to cure the atherosclerosis. This just saves time. But likely, if this happened once, it may happen again. Another thing that can happen is a stent procedure. So if there's an obstruction, what doctors can do, another procedure that tries to correct blockage or partial blockage is a stent procedure. So this can be done in arteries of the heart or arteries of the legs, different arteries in the body. And so basically what happens is that a doctor will guide this mesh, this metal mesh with a balloon inside of it towards where the blockage is. And once they arrive at the blockage, as shown on this picture, look at the first one on the left, you see the blockage. The balloon is pumped up. Look at the middle picture. See, the balloon is filled with air, and that opens up the artery, expands the wall. Then the balloon is removed, but the metal mesh remains in the arteries. And this can enlarge that area so there can be better blood flow. But again, just like the bypass surgeries, this is not correcting the problem of the atherosclerosis. This is actually just buying time and allowing the blood to move through the blockage.